Hi, my name is Joel Crater. We're at TED Conference 2024, and I'm sitting here with Dr. Ali Golshan of Solvang. Dr. Golshan, could you give us a brief background of what got you excited about being an interventional radiologist and what brought you to want to invent the next orbit in treating venous ablation? No, it's not venous ablation, is it?
Venous insufficiency.
Let's start over again.
Yeah. One more time.
Yeah. Yeah. Hi, my name is Joel Crater. We're here at the TED Conference 2024, sitting with Dr. Ali Golshan of Solvang. Dr. Golshan is an interventional radiologist and has come up with a new catheter to treat venous insufficiency. Dr. Golshan, where does your passion come from to be an interventional radiologist, and what got you the moment that you decided that developing a new catheter was the right move for you?
First of all, Joel, thank you for having me, and thank you to the organizers of the event for inviting me. So what got me into interventional radiology was that, unfortunately, my dad died from a ruptured intracranial aneurysm, and his doctor was my mentor. And so he introduced me to the field, and he was a serial innovator. The first neurodetachable coil was created in his laboratory by another physician, and then he invented Onyx, which was a liquid embolic, and the first clot retriever for brain strokes called Mercy. And really just watching and learning the genius that was Dr. Vinuela impacting patients gave me the passion for medical innovation. And I practice in Southern California in a primarily outpatient setting where I focus on all things peripheral vascular, from superficial venous to deep venous to arterial. And while I enjoy treating my patients and I enjoy all of the pathophysiologies that I treat, the reality is that superficial venous disease is the most common in terms of prevalence and incidence of all of the different foci of vascular disease. And I thought to myself, how can I bring a technology that has the biggest impact by getting a better tool into the hands of all of the physicians that treat superficial venous disease and create a force multiplier to be able to take better care of patients and have physicians have better tools at their disposal.
And what exactly is the Solvang catheter?
Yeah.
And how is that going to change the orbit that we're currently in with the landscape of technologies that exist today?
Sure. So when we're talking about superficial venous insufficiency in the legs, laymen call them varicose veins. You can call it venous insufficiency regardless. It's not just a cosmetic condition, it's a medical condition with a continuum of symptoms that include pain, swelling, discoloration, the number one cause of non-healing ulcers in the lower extremities. And the way that we treat them now is we either burn them shut with a wire that heats up at the tip, which can cause skin and nerve injury, meaning that you have to inject about half a liter of saline and lidocaine to insulate the adjacent tissues, which can be painful and time-consuming. You can glue those veins shut, but that glue is a foreign body that can cause a hypersensitivity reaction and inflammation. Or you can inject a foam, which chemically seals it shut, but the limitations with the foam are that it can go to the wrong veins, cause injury to healthy veins, the closure rate can be a little lower on larger veins, etc., and it can cause a lot of pain and inflammation after. So the way I thought was, here's a grid. These are the things that are good about each of them. These are the things that are potentially improved upon with each of them, and brought it all together and tried to create a comprehensive solution that could create a step forward in the paradigm. And that's essentially a catheter that is a non-thermal, non-tumescent, no heat, no numbing, that is catheter-based, that gives the doctor control, that has no permanent foreign implant. And so it's a mechanochemical ablation device. It's an established concept. You cause injury to the vein with a mechanical object, and then you use a medication that's a chemical component, and together with that synergistic effect, you get a very good closure rate without the need for heat, without needing to leave something behind, and having more effect than medication alone, and also giving you more control and less complications.
Well, we're certainly lucky to have you at the TED Conference this year. What message would you leave us with as we move forward, and what does the future look like for treatment of this type of patient and this type of disease?
I would say the future is bright. I think as a vascular community, we need to come together and work as a collective to take the best care possible of our patients, because they have made us their stewards for their health, and we owe that to them. And just having a collaborative effort to share our knowledge and bring tools from other foci into this focus and vice versa. Often, the most amazing innovations are when you take a technology from an adjacent field and bring it into your field, because the solutions are out there and they're often well established. We just need to have a mild paradigm shift in the way we look at it. And I'm excited to bring this technology and in the near future other technologies that provide better options that are less invasive and faster recovery faster, better, cheaper for patients with peripheral vascular disease.
I'm Joel Crater. Dr. Ali Golshan, thank you so much for your time today, and we look forward to seeing you next year at the conference in 2025.
Thanks so much for having me. Really appreciate it. See you guys soon.